So I'm Dr. Mike West. I'm a consultant psychiatrist who qualified in 2014. Since qualifying as a specialist, I completed a year-long fellowship in Psychopharmacology, which is essentially how drugs work in the brain at UCT. And at the same time was also convening a postgraduate diploma in addictions care, which was a unique collaborative effort between the Department of Social Development and the Department of Health in terms of upskilling and training professionals to become more proficient in the addiction field. Subsequent to that, I've left the state sector and have a private practice in Cape Town, South Africa. However, do maintain an ongoing teaching responsibilities at the University of Cape Town, where I lecture undergraduate students, postgraduate students, as well as participating in continued professional development courses for general practitioners and other specialists. There have been three traditional approaches that governments around the world have initiated to try and combat substance use disorders. And those are referred to as supply reduction, which is self-explanatory, demand reduction, which itself is self-explanatory, and subsequently harm reduction, which is actually less self-explanatory than the other two terms. Now, in South Africa, we focus very much on supply reduction and demand reduction. Whereas if we look to centres and countries elsewhere around the world, for example, Portugal and certain states in the United States, Ireland, for example, and Australia, there's been a shift in emphasis towards harm reduction. So what do we actually mean by harm reduction? Harm reduction essentially refers to a set of public health policies that have been put in place to minimize the harm that is associated with using substances. For example, needle exchange programs, safe injection sites, the prescription of medications such as opioid substitution treatment or methadone for people that are heroin addicts. And a very real world example that I think many people will be able to relate to is, for example, using e-cigarettes instead of normal tobacco cigarettes. Traditionally, the substance abuse treatment landscape has become dominated by 12-step groups. Over the last 80 years or so, ever since Bill Wilson published the Big Book, which was the sort of forerunner, I suppose, to Alcoholics Anonymous and Narcotics Anonymous. It's now got to a point where over 90% of treatment facilities around the world take a 12-step based model and apply a 12-step based model. Now, a 12-step based model really does emphasize abstinence as being the ultimate end goal of treatment. And while for many patients abstinence is the best end goal for treatment, there are also an equal number of patients where complete and total abstinence is not feasible or realistic or actually achievable at this precise moment in time. And by putting patients into a treatment setting where it is either abstinence or not, you are successful or you are a failure, has a risk of ostracizing and alienating patients who are ambivalent about whether they want to stop using. So it is our responsibility, in fact, to provide alternatives for patients and to try and blend together those two different schools of thought into a more meaningful, cohesive and cogent whole that would actually benefit the patient far more than being a user or a non-user. So some of the alternatives when it comes to harm reduction, for example, would be using medication to help reduce the frequency or quantity of drugs that have been consumed. It would be other measures, for example, such as providing safe injection packs for people that are intravenous users, or to a greater extent, discouraging use of drugs in very harmful ways. So for example, there is no more dangerous way to use a drug than intravenously. So if I have a heroin user coming to see me and he would like to stop using heroin intravenously and would rather smoke his heroin, some people would say that that is a treatment failure. But for me, that is a huge success, because that patient is actually wanting to do something positive to limit the risks that he has by using an intravenous drug, for example.